Assalamualaikum and very good morning, everyone. I hope everybody is up and awake. Okay, today I'm going to talk about this topic, learning disability in higher education. And it seems that it's an elephant in the closet for most of our students. I am a child endorsement psychiatrist currently working into hospitals, which is Hospital Columbia Asia, Iskandar Puteri, and also Hospital Permai Johor Bahru. Okay, so when we talk about elephant in the closet, actually there's two combination of the common idioms, which is skeleton in the closet, which means something that we don't want anybody to know, and the other one is elephant in the closet, which is elephant in the room, which is something really big, and we do not want to discuss about it. So that is what elephant in the closet is about, whereby we feel that having a learning disability in higher educations feels like there is something that really big and suffocating, and we're not able to tell and get help at times. Okay, and being able to get help and being able to find ways to manage our stress is one of the most important ways of getting a well-being of our students move ahead. So learning disabilities are lifelong, and it is something that has to do with our brain, which is neurologically based. And it is capable of interfering with individual ability to process academic and organizations and social communication processes, which is very vital in the higher education. And when we talk about learning disability or learning disorders, there are multiple things that we have in mind. And I only would like to touch on a few for today, which is about dyslexia, dyscalculia, and dysgraphia, which is what we call specific learning disabilities. Okay, so for dyslexia, it's about inability to really grasp the phonological kind of processing to help you to read. Okay, for dyscalculia, it's about the inability to really grasp the concept of mathematics, and dysgraphia is about handwriting and putting things into papers. Okay, so this is what happened in the dyslexic brain versus the normal brain. So we can see on the left side is the three areas you need when you do a little bit of reading. This is the normal brain. Okay, the place that's lit up. Okay, there is the Broca's area, the red area, where there are words analysis and articulation, and then the blue area where they analyze the word, and then the green area where the word is formed. But in dyslexic students, we find that the other two areas are not lit up. Thus, it makes it a little bit longer for them to really process what they read and comprehend, or even to understand what is being read. Okay, so the Broca's areas in these students seems to lit up more to overcompensate for whatever they're not able to do in the normal kids. And sometimes patients with dyslexia have problem with what they see, but basically the eyes are normal. It's about how the brain is getting the information and how it was being manipulated. Okay? So a lot of students complain that when they look too long at a lot of written documents, sometimes it swirls, sometimes it kind of like wiggle, sometimes it just like becoming three-dimensional. Thus, making reading is a little bit more difficult, and it took longer time to read. And one third of dyslexic complain of eye strain and visual distortions while reading. And sometimes this cause an unpleasant subject symptoms called Maris-Erland syndromes. But Maris-Erland syndrome can happen both in people with learning disabilities and not. And at times, people with dyslexia also have visual tracking problem, thus making it very difficult when they want to see anything in front, far, especially in the whiteboard or the blackboard, to get it translate from what they see to what is being written down. So they take longer time to do that. Okay. Then when we talk about dyslexia, again, it's not all about difficulties. I mean, the students have been where they are, performing as well as the other normal kids. Okay, but there are constant struggle in where they are. Okay, the dyslexics may struggle with organization skills, planning and prioritizing, timekeeping, and keep a lot of distraction with the background noise. But they are very good problem solvers, They are brilliant, they can connect ideas, they usually think out of the box, and they are able to see things in a big picture. So most likely they are better problem solvers. Okay, so any of you would like to check for adult dyslexia, you can go through this link. Then there are other disorders that might impair learning, such as autism and ADHD, whereby autism, most of the symptoms is related to communication. It is very vital also in academics world. You need to work in group, you need to present, you need to get input and output. So it's kind of a little bit difficult for autism, but I'm not going to go into that. I'm going to go a little bit more on ADHD, which is attention deficit hyperactivity disorders. And for the past year, we have found that it is very, the number of adult ADHD being diagnosed is kind of like 4 times the usual. So there is like a progressive increase in the number diagnosed in the children for about probably 20 to 30%. But in adult ADHD, the number rose up to 120%. So there's a lot more people, a lot more adults, especially among the students who came to us to know more about their symptoms. Okay, so when we talk about ADHD is not just a simple diagnosis. The ADHD brain, okay, had a lot of functions, and like I mentioned in this slide, some of these functions are gonna be affected in ADHD. For example, like activation, why they have, you know, unable to organize, and then why they are unable to keep focus, and then there's a lot of effort need to just be alert, whereby their brains are not listening to them. You know, it's like when somebody say, "Hey, keep focus," but the brain just like, "Whoosh, I'm not gonna listen." Okay, and then there are also emotion part of the ADHD, the memory part of the ADHD, and the actions. They can be impulsive at times. Okay. And then you can see from this slide saying that when it was diagnosed earlier, ADHD is just only ADHD. But as they age, there are a lot of other complications that can arise from this. Okay, there can be school exclusion, there'll be difficulties in complex learnings, there'll be lack of motivation. And as they grow, the complication become more. 35% of them might school drop out, okay, and there's a lower rate of productivity and higher rate of absenteeism. Okay, and it's very difficult for the ADHD to find a job compared to the normal students. So it's a rising disorder in the adults, but it's still under recognized. So these are some of the symptoms of the ADHD, the DSM-5 criteria for adult ADHD. Somehow the criteria are much more lenient in the adults, okay, but basically the same, okay, whereby it's coupled of 2 major group, which is inattention and hyperactivity and impulsivity. So the diagnosis of ADHD is not simple as, hey, you are hyper, so you're ADHD. No, because they need all this collection of symptoms to say they have a problem that needs and justify to get further intervention. Okay. So ADHD, of course, got also their strengths. Okay, they're because of they're very energetic, so they're quite productive. They're very hardworking. They like to go out of the box. You know, they are doers. They are very determined, and they are very creative. Okay, so if you are interested to know about, see whether any of us have adult ADHD, you can go to and Google this adult ADHD self-report scale version 1.1. So, yep. This one is just to highlight that LD is not about having a bad IQ. Okay, you're just being assessed differently. Everybody's a genius, but if you judge a fish by its ability to climb tree, then it will live its whole life believing that it's stupid. So same goes actually to our orang asli population, when we try to do IQ tests to these people and find they are not compatible, but then orang asli has a different set of skills in which we don't have. That's for example. Okay. They are not lazy, they are not dumb, they are as smart as everyone, but their brains are simply wired differently. And from this study, it's found that there is no significant difference between LD and non-LD on grade point average and number of course taken. Means people with LD are struggling and trying their best and very determined to actually keep up with the students without LD, despite having more difficulties on humanities, social science, and foreign language. And those students with LD prefer additional oral and visual explanation. They are more concerned about lack of time, mostly it's that. They are more prone to stress, they are mostly nervous, they get more frustrated, and feels that sometimes helpless and uncertain compared to the kids without LD. And non-LD, basically, they are more to the more written techniques. They are actually childhood disorders, usually diagnosed at younger age, or however, sometimes not diagnosed at later age. Because of that, because of the complication, they usually presented with anxiety and depressive symptoms rather than the LD itself. Okay, it's a constant struggle. Their brain do not cooperate, and they live in a society that wasn't built for them. So many choose not to disclose to their instructors or their educators about their problem because they don't want to feel stigmatized. Okay, and then looking at the prevalence of depression among university students, the mean prevalence is about 30%. And factor implicated in psychological morbidity among students, the top two will be academic pressure and demanding workloads. So, you have LD, you have demanding workloads, you need more time, and sometimes that makes you feel a bit helpless, and then you go into a spiral of depression. What can we do to help? The general principles is that you get to know these kids, these university students, and you give them more time to complete the task. Either you cut the task into smaller tasks, or you give them more time to complete. Okay, and this is one of the most important things that I figured here is that people with ADHD or LD has problem with applying what they know into what they can apply. Okay, so a little bit of mentoring is very important because the mentor will just put what they learned and what they need to know and what to apply in a more clear perspective. And their need for instructor and student relationships, because in this way it is like kind of like a guided kind of study. The more there's something, the goals are quite structured, frequent meetings. If they don't know, they have any problem, there's always somebody that they can ask about or look upon to. Okay? And another one is sensory integration. So students will learning this ability usually will figure out by themselves what is comfortable, what is not comfortable for them in terms of environment. Sometimes they like to study in their room, sometimes they go study under the tree, sometimes they go study in their exam hall. Depending on that, they have to figure out what kind of sensory integration is most important to them. And yes, definitely wellness, eating right, sleeping right, having a good crowd of friends. Wellness usually reduces the stress, thus making them more capable to cope with whatever difficulties they have in terms of their learning disability. And definitely, whenever it's needed, individual therapy is indicated. Okay, so LDs, there's no cure. You just need proper diagnosis and a proper intervention. LDs are not lazy. They work hard on their task that other people actually take for granted, like reading and writing. So those with LD needs to work more to gain what their normal students are doing. And people don't just grow out of LD. They find coping strategies a better one just to excel more in their life. Okay, with that, I thank you. I would like to hand back the mic to the moderators.
Thank you very much, Dr. Rahidah, for the informative presentation on learning disorders. I really love that part. Not lazy, not dumb, just smart as everyone else, just their brain wired differently. They are actually very bright students. They have the potential to shine if they are well supported.